Hi, my name is Whitney and I'm a registered dental hygienist. If you're new here, welcome. If you've been here before, welcome back. Today we're talking about sensitive teeth, specifically cold sensitivity, and what you can do to relieve it using evidence-based dental advice. First, sensitive teeth. Why are they sensitive? So teeth are covered in pores called dentinal tubules. Inside each of these tubules is a pathway that leads to the nerve of the tooth. When these tubules become exposed, sensations like cold, air, or touch can travel straight to the nerve, and that's what causes that sharp, jolting pain. So things like drinking ice water, biting into ice cream, brushing with cold water, or even breathing in cold air can trigger sensitivity. Now, one of the most common causes of this happening is gum recession. Gum recession happens when the gums pull away from the tooth, exposing the root surface. Unlike the crown of the tooth, which has enamel protecting it, the root doesn't have the same protective layer. So those tubules are much more open and reactive. I have an entire gum recession dedicated video, which I'll link below if you want to learn more. But for the purpose of this video, if your sensitivity is caused by gum recession, here's what you can do to help relieve it. First, scale back or stop whitening. Teeth whitening products open up those tubules even more, which makes sensitivity worse. If you really want to do a teeth whitening treatment, instead of putting the strips on every day, try switching to every other day, or even better, ask your dental provider about a lower concentration of whitening or pause whitening altogether until the sensitivity improves. Next, switch your toothpaste. If your toothpaste says whitening anywhere on the tube, stop using it. Whitening toothpastes tend to be more abrasive and worsen sensitivity. Instead, use a sensitivity toothpaste. Look for ingredients like potassium nitrate or stannous fluoride or even sodium fluoride. These ingredients help block or calm the nerve response by sealing off those exposed tubules. This is one of the most effective ways to manage tooth sensitivity. And something that may help, it's not totally evidence-based, but it's something to try. After brushing with sensitivity toothpaste, don't rinse with water. So you'd brush, spit, and be done. Letting that toothpaste sit on your teeth gives the active ingredients more time to work. This is especially helpful at night before bed. And or if you use a prescription strength toothpaste from your dentist. But if the texture bothers you, I get it. You have two options. If you wear a night guard or retainers, or you have custom whitening trays at home, put the trays on your teeth immediately after brushing with the sensitivity toothpaste to help hold the toothpaste against your teeth. And then you can tongue scrape and get the residual paste out of your mouth. Or if you're like, no way, there's no way I'm keeping toothpaste on my teeth. Ew, I get it. Instead, be sure to use a sensitivity or fluoride mouthwash after brushing and flossing. So you swish with the sensitivity mouthwash, spit, and don't rinse afterward. A little more info about adding mouthwash. Adding a sensitivity or fluoride rinse to your daily routine can help coat your teeth, block tubules, and reduce sensitivity throughout the day. It can only help, it can't hurt. But it's important to know that mouthwash is not a cure-all. It's just an additional thing you can do on top of proper brushing and flossing. So just remember that. Mouthwash is never the answer, it's just supplemental in addition to all the other things. Something else to note, if your sensitivity is localized to one or two teeth, you can try a spot treatment. I have lots of patients that do this and swear by it. So what you want to do is take a small amount of sensitivity toothpaste on your finger and rub it directly onto the sensitive area before bed. Let it sit overnight. This concentrated approach can make a huge difference, especially when combined with a night guard. Because if you clench and grind your teeth while sleeping, wearing a night guard is incredibly important. Grinding puts stress on your teeth, contributes to gum recession, and can worsen sensitivity over time. A custom night guard from your dentist is ideal for preventing sensitivity, but even a temporary over-the-counter option is better than nothing. I will link some products below if you're interested in making your own night guard at home. Again, I recommend the custom one made by your dentist, but something is better than nothing. And finally, if you've tried all of these options and you're still experiencing sensitivity, talk to your dentist and or dental hygienist. Many offices offer fluoride varnish treatments that can provide months of relief, especially for spot treatments. There are also prescription strength sensitivity toothpastes with higher fluoride levels that can work faster than over-the-counter toothpaste. And be aware that cold sensitivity can also be caused by other things other than gum recession, such as enamel erosion, orthodontic treatment, large fillings, new crowns. That's why it's always important to visit your dental office to determine the cause of your sensitivity before trying to treat it on your own. Overall, sensitive teeth due to gum recession is unfortunately quite common, but it's not something you should ignore. Always start by identifying the cause with your dental provider. If your sensitivity is due to gum recession, consider doing the things we just talked about. Stop whitening, switch to sensitivity products at home, add fluoride mouthwash, and protect your teeth from grinding with a night guard. And I hope this video helped you. Please like, subscribe, and turn on your notifications if it did. And if you want more teeth talk, you can visit my website, teethtalkgirl.com, or hang out with me on Instagram at teethtalkgirl. Peace, love, and teeth.